Hello everyone and welcome to our module on twins. In twins, there is one pregnancy that produces two babies, and there are two general subtypes of twin pregnancies. Some pregnancies produce what's known as dizygotic twins. Like the name implies, this means there are two separate zygotes. This happens because two separate ova were released and fertilized by two separate sperm. Basically, in a dizygotic twin pregnancy, two siblings are simply born from the single pregnancy. These two babies came from a different egg and different sperms. They are like brothers or sisters. They just happen to be delivered at the same time. And these are sometimes called fraternal twins. The word fraternal means like brothers, and these are twins that are like brothers. In contrast, monozygotic twins occur when one zygote divides in two. So these twins are identical. A single ova is fertilized by a single sperm. The genetic material of the two twin children is identical because basically a zygote split in half to form two babies. And here's a picture just to make this very clear. On the left side of the screen is the situation in monozygotic twins. So one sperm, one egg, and then the zygote divides in two, and there is a shared placenta. We'll talk more about that in a minute. In fraternal or dizygotic twins, there are two eggs and two sperms that form two separate zygotes, which each have their own separate placenta. Each of these zygotes is going to implant into the uterine wall like a normal pregnancy and develop its own placenta. One thing you may not know about twins is that often one twin dies in utero and there is resorption of the fetus or embryo. And if the mother didn't have imaging to know that she had a twin pregnancy early on, she may never know that this was the case and simply deliver a single baby. In addition, you should know that when there are more fetuses in the womb, the pregnancy becomes shorter. So a single fetus pregnancy is about 40 weeks. Twin pregnancies are usually about 37 weeks, and triplet pregnancies, which are very rare, are about 33 weeks. As I mentioned before, you can think of dizygotic twins as simply two pregnancies that happen to occur at the same time. Each baby will develop the same way a baby develops normally. So each baby will have its own amnion and chorion. These pregnancies are called dichorionic, diamniotic. In addition, each baby will implant in the uterus and develop its own placenta, so there will be two separate placentas. And this type of twin pregnancy is very common in mothers who use in vitro fertilization. Via IVF, often two eggs are released at the same time, and that can result in dizygotic twins. Monozygotic twin pregnancies are a little bit different. In these pregnancies, there may be a single shared placenta for both babies. In addition, each baby may have its own amnion and chorion, or they may share an amnion and chorion. It all depends on when the zygote divides. Remember that in a monozygotic twin pregnancy, a single egg is fertilized by a single sperm. Remember that fertilization takes place in the fallopian tubes, and then the zygote moves down toward the uterus. So if the zygote in a monozygotic twin pregnancy splits early on after fertilization, then two separate zygotes will travel down the fallopian tube and implant. This will be a situation very similar to what you have with fraternal twins. You can get two separate placentas, each with its own amnion and chorion. On the other hand, if the zygote divides later on, say after the zygote has moved down the fallopian tube and reached the uterus, then you can get a situation where the two babies are sharing a placenta and even sometimes sharing an amnion and a chorion. The way this works is if the zygote divides in the first 1 to 3 days after fertilization, you will have a situation very similar to a dizygotic twin pregnancy. You may have two placentas, or the placentas may fuse together into one, but you will definitely have two chorions and two amnions. So each baby will have its own chorionic membrane and its own amniotic membrane. If the zygote divides in days 4 through 8, at this point, the developing zygote has entered the blastocyst stage and the chorion is under development. So you are going to get a pregnancy with a single chorionic membrane that contains two amniotic membranes, each with its own baby. This is called a monochorionic diamniotic pregnancy. If the zygote divides later at days 9 to 12, at this point, the zygote has implanted in the wall of the uterus, and the chorion and amnion are both under development. So when this happens, you're going to get a monochorionic, monoamniotic pregnancy. There's going to be one chorion, one amnion, and the two babies will be inside. And it's very rare, but if the zygote divides at day 13 plus, you will still have a monochorionic, monoamniotic pregnancy, but at this point, parts of the body are beginning to form. So this is how you can get conjoined twins who are sharing arms or legs or other parts of the body. And here's a picture just to make this more clear. Cleavage of the zygote in days 1 to 3 happens when the embryo is in the morula stage. This leads to a dichorionic, diamniotic pregnancy. Cleavage in days 4 to 8 occurs when the embryo is in the blastocyst stage. This leads to one chorion but two amnions. If cleavage occurs in days 8 to 13, you now have an implanted blastocyst in the wall of the uterus. This will lead to a monochorionic, monoamniotic pregnancy. And then, as I said before, cleavage beyond day 13 is when you've begun to form the embryonic disc, and this will result in conjoined twins. And I'll finish with this slide and just mention that twin pregnancies are higher risk pregnancies. There's an increased risk of complications for both the mother and the babies. For the babies, they are often small, they have growth restriction, they sometimes have congenital anomalies, and preterm delivery is common. Remember what I said, twin pregnancies tend to be shorter, so the babies have less time to grow, and they sometimes are delivered at preterm. In addition, for the mother, there's a higher risk of gestational hypertension and preeclampsia. And that concludes our video on twins.